Hi, my name's Dr. Kristin Soda and I'm here to talk to you today about a subject close to my heart called dysphonia. As I've had a personal experience with dysphonia, being diagnosed 12 months ago with something called spasmodic dysphonia. Now, we're a very rare group, spasmodic dysphonia, about 30 per million people have it. And it's an extremely isolating condition as it affects voice. The definition of dysphonia is not a speech disorder per se, but a disorder of the voice box or the larynx, and it's characterised by altered voice quality, loudness, pitch, and vocal effort that impairs your ability to communicate and decreases your voice-related quality of life. One of the reasons is that I'm interested, as I've just said, is that I have spasmodic dysphonia and it's currently treated, so I may not sound very different to you. But it took a long time to diagnose. This time last year I was speaking in a very staccato way. My voice would have continuous breaks in it. I would have difficulty beginning some words and my voice would stop in the middle of some other words. I was very difficult to understand. It may be very useful for you to hear how I did sound about 12 months ago, and this little excerpt is of me attempting to count from 80 to 89, and it's very broken up and it probably won't recognise any numbers at all, and at one point I do begin to laugh a little bit, and that's when you hear a bit more of my voice.
81, 82, 80, 84, 85, 86, 87, 88, 89.
The only way I could have continuous voice was to whisper, and despite what you think, whispering requires a lot of muscular effort, and this led on to sort of tension headaches. And then after 3 or 4 months of some speech therapy, which was not really helping, I was referred on to a Melbourne ear, nose, throat and speech therapist, and we diagnosed spasmodic dysphonia by looking directly at the vocal cords. That's called a laryngoscopy. And a further 6 weeks on, so 4 months into the dysphonia, I was given my first Botox injections. They're given in this area here into a very tiny muscle, and I am fortunate in that spasmodic dysphonia of the adductor type, the muscles are far easier to reach. And I had quite an immediate effect, so within a week I felt like I had some of my old self and my old voice back. Now this may not be the same for everyone's journey, but I feel that it is something we need to speak about when we can, and I know how isolating voice disorders can be. I just wanted to try and explain what spasmodic dysphonia is for you. It is from a group of disorders, neurological disorders called a dystonia. So you may have experienced an eye twitch, which is a spasm of the muscle around your eye, and people with spasmodic dysphonia have a very similar spasm but in a muscle in their larynx. From my experience, what I've seen and heard in myself is that I noticed a voice tremor in probably the month before it became really severe, and I would sound a little bit nervous to myself and perhaps to family and friends when I didn't feel nervous. So a voice tremor, and then it was really for me quite a sudden deterioration in voice. So I couldn't project my voice, it was staccato, and yeah, very disrupted. It was like I had a really bad laryngitis that just wouldn't go away. So in the circumstances of someone who develops a voice change, and you can put it down to, say, a viral infection, I still think we need to look after our voice at that time. So you may need to rest your voice, you may need to take some time off work to rest your voice. But if it persists beyond 3 weeks, I think you definitely need to be checked. And if it persists beyond 3 months, you really need an ear, nose, throat doctor to have a look, and that's called a laryngoscopy. Well, your local GP will hopefully know of some, but this network that I was in contact with, the Australian Dysphonia Network has been very helpful and very supportive for myself. So ADN. It's very individualised if you can receive treatment that is individualised. I am currently having them about 6 to 8 weekly, so smaller amounts more often for myself. Some people who don't perhaps use their voice as much as I do could probably have them, say, 12 weekly. And they're very small injections. They are a little bit painful, but it is over and done with quite quickly. I think when we think about the body's senses, you know, eyesight, hearing, we can sort of all imagine someone who's lost that and how devastating that is, but we never think of our voice as being something that's really crucial to who you are and what you do. And because my profession involves speaking all day, the effect was profound. You know, your voice is where you can show your personality. It is very much a part of who you are. And I think when that goes, I think we need to take it seriously and investigate it as quickly as we can. And it has been shown that people with spasmodic dysphonia are often, the delay in diagnosis is there, and it can be years before they're diagnosed. Because we're a small group and rare, we don't actually know the cause. We know it's neurological, and we know somewhere between the brain and the nerves that come down from the brain and innervate the voice box are affected. But we don't quite understand why that happens. I fit the sort of classic group of people who are affected with spasmodic dysphonia. It does affect women more than men. It tends to begin in middle age, so beyond the years of 40, and yeah, that sort of cluster group of people, and that's not males, and people older or younger are not affected, but I sort of fit the classic mould of that. So Botox is a treatment but not a cure. There's some research going on about some medication that can affect some people with spasmodic dysphonia and help them, but it's very specific, and I'm not really sure about whether that's even available in Australia yet. There are some famous people with spasmodic dysphonia. The singer Jenny Morris has it, and there's a famous USA cartoonist, he writes Dilbert, he has it as well, and I believe he has had a surgical intervention where they have tried to reimplant the nerves around the larynx, and with much rehabilitation and speech therapy, he's speaking reasonably normally now. But that's very expensive, and it's still experimental.